Good afternoon, everyone. I am not going to stand behind that podium because I'm short. My name is Megan Cotter. I'm the executive servant leader of Micah Ministries, and this is the Senior and Disabled Housing Workshop. This is the subject area in the housing frontier that becomes literal, life and death, and relational. And we have two really wonderful presenters here that have been in the disability and aging work for a very long time. Debbie, I think we decided, has been with Disability Resource Center for about 25 years, doing a variety of different things to support people with disabilities. And then Pat, we didn't decide on a year, but she's been with Agency on Aging, Healthy Generations since God. So has been with the organization a really long time and really come up through the ranks to be their executive director. A couple things I will share in my work with the unhoused, who you may or may not know, 74% of the people who live on our streets are people with disabilities. And that's sometimes shocking to people because it often doesn't fit our stereotype of what homelessness means in our community. So this idea of housing for people with disabilities is near and dear to my heart. You heard a statistic a little earlier today about the available affordable units in communities per every 100 person. And I want you to know that in the Washington, D.C. metro region, which is our region, we have 27 units of affordable available housing per 100 people who need it. So that really kind of carves out the Grand Canyon of need. Another statistic that I recently heard and has been tossed around a little bit today is that 50 is the new 75, which is really speaks to the impact that housing has on people with disabilities. You may or may not know also that the low often for someone who's on Social Security, meaning they've been determined disabled, is 914. Is it 941? 941, sorry, I got my numbers wrong. And the average in Virginia is 1371. The fair market rent on a one-bedroom apartment in this area is 1310. So you can do the math. The other thing that I really want to drive home as we get started today is really asking you all to wrestle with this idea that we tell ourselves that systems are going to take care of people when they get older, when they have a disability, and the reality is that systems were never meant to function outside of friends and family and supportive relationships. And when people don't have that, they profoundly struggle, and housing is a key part of what's in the center of it. My shameless plug is that, as an indicator of how dire the housing crisis is for people with disabilities, many of you all know Micah is working on a housing project called Jeremiah Community, which will be a supportive neighborhood for people who are overcoming homelessness. Everyone who lives there will have a disability of some type and often has lived on the street for years. And I've been pleased to hear today a lot about the struggle of getting through the processes that are often at play when it comes to building housing, period. And one of the things that I've had to grieve, frankly, is realizing that the people I know who have lived on the street that have helped us develop this idea of Jeremiah Community are not going to live long enough to live there because the processes that are at play and the things that we have to work through are going to take so long that, and their lifespan is drastically reduced by having been on the street. will keep them from ever getting to experience it. So we're building for the next generation of people. So homelessness, of course, is a worst case scenario, I think, but there's a much broader range of struggle created by the housing crisis, I think, that our panelists are going to speak to today. So I'm going to turn it over to, going first, Pat. Where's Debbie?
Sure, you can drive. Thanks. We'll just sit here. All right. So, how many of you in the room have family members with disabilities? A lot. Aging? Are aging? So I'm Debbie Fulton. I started with the Disability Resource Center doing youth services, helping families navigate the IEP in school and help them expand their horizons on what transition can look like and what your young adult can do after school. And from there, I added Social Security benefits planning, which is a whole nother world, helping people on benefits learn how their benefits will be impacted by earned income. And that's just a wonderful program that started in 2000, where people can actually try work before they jeopardize their health care is usually what people were worried about, not their cash benefit as much if they were going to make money. And that morphed into many years and becoming the director in 2006. And so I've enjoyed leading this organization and adding lots of different programs to what we do. But I just want to give you a little idea of what we do. So we're unique because the majority of our board and our staff are people with disabilities with lived experience. There's 403 centers for independent living across the country, and there's 17 in Virginia. So we're one of 17. We're funded by the state government, all 17, and 6 of our CILs get federal money. And so there's a whole formula why that happened, and there's been no new money in IL in many years. To expand that. The Disability Resource Center has a core grant from the state, and then we enjoy partnerships with all the local governments and have programs funded by the local governments in our area. And then we do some fee-for-service, Medicaid, service facilitation, and look for other grants and opportunities and needs in our community. We're currently looking at a large grant through HUD to help with accessibility for people in housing, and we're hoping that that may go through. But the 5 core services of independent living are advocacy, and the old-time IL, it was advocacy. There's a chain of to your White House steps, you know, that kind of thing. Peer mentoring, and so that's a person with a disability helping another person with a disability figure it out. Understand where they are and help them develop goals to move on from injury or illness. Independent living skills training. We did a marvelous job of remodeling our kitchen so we could do classes right as COVID hit. So we're just starting to get back into that. But helping people learn things learn to do things differently because of disability. So that could be cooking in a seated position, or learning how to budget. Maybe they never even did that before they became disabled. And that can be done at our office, in the community, at their home. Just depends on what the individual wants or needs. And it can be done in a group model or individually. We go out to the counties to see people at their home individually, and we have some groups in our office also. We also do transition, help people learning what to do next after high school, what's out there, what are the possibilities, get them learning self-advocacy for young adults is something that's very important. As a parent, I forgot to tell you that, I'm Derek's mom. Everybody knows Derek. He's used to work at the movie theater before COVID, lives independently in a house that he rents, and he has a non-disabled roommate. And so that's one of the things I'll talk about as far as housing options. And then information referral, by far our largest service. Who does what, where, get numbers, and if we don't know, we'll help you we'll find out for you. Then we also have The Equipment Connection program, most people know about that. If you've fallen and you need a walker for a short time, or you need it because your insurance company won't pay for it, whatever reason, we give out over 2,000 pieces of equipment a year. And some of those are the disposables, not because we intended to, it just happened. People give us bags of adult diapers, and we give them out. And we have people that regularly come because they don't have funding for that. And so we found out it was important need, even though we didn't really have the space. But walkers, wheelchairs, bedside commodes, hospital beds, just all kinds of different things right there on Princess Anne Street. And we facilitate 3 different groups: a youth group, a young adult group, and then an adults with disabilities group. So if you're interested in learning more, please meet my new friend Seth Witten that's out at our table. He's our deputy director. We're thrilled to have him. He's only been on board a couple of months, and you can sign up for our newsletter.
And that's Debbie.
That's me.
First of all, thank you for being here, because the majority of the time that the Healthy Generations Area Agency on Aging goes out to any type of a health fair, people will cross the hallway, cross the street, whatever, to get away from aging. Now, do you really want to get away from aging? The alternative isn't so good, so I do appreciate everybody for being here. It does make a big, big difference. So Healthy Generations started in 1976 as the Rappahannock Area Agency on Aging. I see Mayor Greenlaw singing it with me, which is something that we've done for years. We are governed by a board of directors that is made up of either a city council member or a board of supervisors member from each area in the planning district. And also, each of those appoints a citizen appointee. And then we have an advisory council. That person, the chairperson, is on our board. And we have 2 at-large positions, and that's how the agency is governed. We are funded, much like Debbie. The Older Americans Act provides funding for certain programs for people that are 60 and over. We also get state funding and, thankfully, local government funding. Local governments have been very good to us. So that allows us to go out to the community and provide the services mainly for those who are 60 and over. One of the things that we have learned recently is that we have more and more people coming into our office to talk about what their options are, what happens if, where will I go. We're very grateful that the conversations are occurring out there. So please keep it up, keep sending people, and know that we are here. So both Debbie and our agencies cover the city of Fredericksburg and the counties of Caroline, King George, Spotsylvania, and Stafford. I know Debbie also has another planning district that she does some work in. So I'm going to turn it over for Debbie for a second.
Okay, so in Virginia, like all states, we have a organization of members of the community and legislators and people with disabilities who make a state independent living plan. And so that state plan for independent living includes looking at where are we not covered. And so one of those areas is PD9. PD9 includes Culpeper, Madison, Orange, and Rappahannock. Fauquier is part of the SIL in Manassas, so they're covered. And so for the past several years, we've been trying very hard to get a group of people interested in a Center for Independent Living in that area. Not to become, an extension of DRC, but we would have a satellite that we would assist in developing their own nonprofit out there. So that's the other area of the state. Now, we have had grants in the past, like when I was doing the Social Security work, I had 17 counties. I got to go through the Northern Neck and Middle Peninsula, which was fun, and assist people individually. The purpose of that program was for a community member, not somebody at the Social Security office, being able to explain benefits. And so it really is an independent living model for people with that lived experience, being able to sit down and I guess people trust just another person rather than and the other problem with that Ticket to Work program is such a small part of Social Security. People would call and get a different answer every time they called, so it was a really good program. But individual with a disability is defined by the ADA as a person who has a physical or mental impairment that substantially limits one or more major life activities, so feeding, dressing, bathing, and a person who has a history or a record of such an impairment. And the interesting part about this is it includes or a person who was perceived by others as having such an impairment. ADA is a terrific thing. ADA is not enforced very often. We do have a great connection with somebody at the Department of Justice who's trying to be proactive. Last year, I don't know if those of you in local government remember that they initiated a program for the people who are part of their position, because there's not an ADA coordinator position in most local governments, it's part of somebody's position, but to come together and be able to network and learn from each other. And so they've had a couple of meetings. We reached out, our part of it was to reach out to our local governments and encourage them to send people. And we did have people from all of our local governments then.
So there is not one definition of an older American. How many of us feel like we're an older American? Okay, not so many though. We're good. Some businesses provide senior discounts at 55. Wendy's will give you a free Frosty, so that's a good thing to keep in mind. Active adult communities, they're typically targeting 55. Medicare becomes available at 65 as a senior, and subsidized housing typically is 55 or 62. So as I mentioned before, our Older Americans Act programs start at 60. They're for people who are 60 and over. If you come to my office to find out more about the Healthy Generations, you're going to see a picture of my dad skydiving on his 75th birthday. He would not have said he was an older American, particularly on that day. So it really is a definition, a group of people who are very varied, and we like it that way because it keeps everybody grounded. So the total population of our planning district is 371,000 people, with a population of those 60 and over at about 67,000, all right? So that's been a 59, almost a 60% increase in a 10-year period of time. By 2040, 1 in 5 people will be 65 and over. So that's almost 81 million people. It'll be the first time in the history that there will be more adults than there are children. We need to be prepared in many, many different ways, but housing is one of those that is, you know, like they say, everything sneaks up on us, right? We don't provide preventative care. I think we've learned a lot about that. We try to tend to solve problems, but events like this help us talk about preventative care for all sorts of different things. The population of the disabled residents is almost 90,000. So currently 1 in 4 Virginians is 18 or older lives with a disability. And we all need to be here. This is why we're here. We all need to be here to help folks. So now we're going to talk a little bit about the housing options that are out there.
So I started with the bad news, nursing homes. You know, I know everybody has heard that joke about children picking their parents' nursing home. Well, we tend not to think that way any longer. We are trying to help people stay in their homes, but the realistic problem is there's not enough home care services, or there's not enough support services in the community for people to have that support come into their home. So there's nursing homes in our area, and we definitely try to get in and help people know what the options are if they're not, if they'd like to move back into the community. Several years ago, we helped assisted a gentleman who had a high spinal cord injury, and he lived in his own apartment with help coming in, And the emergency technology is terrific, by the way, to really improve the lives of people with disabilities and the elderly. And so nobody thought he would move out of a nursing home. And he wasn't a very old man. I mean, he was like 55. But he wanted to smoke, and they wouldn't let him. So he wanted to be out in the, yeah. We didn't know we were helping him do that. Another institution is ICFs. The ICF-MRs, you may have remembered back in 2008 that a Department of Justice was called in to investigate Central Virginia Training Center. And this is a place for people with significant developmental disabilities, mental retardation, they used to say. And it took them till April of 2010 to expand their investigation to include ADA and Olmstead. And Olmstead was an act that says if you're going to use public money, that you have to give people the choice to be in the least restrictive environment. So take that money, you know, the $129,000 for the institution, and spend that in the community, because it's always much more cost effective to do that. In 2012, Virginia came to a settlement with the Department of Justice. So it took from 2008 to 2012 for them to do this. And when they did it, a lot changed for people with developmental disabilities. A lot changed with their long-term care waivers. A lot changed with services available. Virginia Department of Behavioral Health and Developmental Services now has housing guides for people with developmental disabilities to help them. There's state money specifically because there's not Section 8 voucher assistance in very many communities open very often. And these are state funds to support community living for people with developmental disabilities. They either have to be on the wait list, everybody knows about the wait list for people with developmental disabilities, or on a waiver. In our community, the Community Services Board has 3 ICFs, and they support 12 people. So they're still called an intermediate care facility because of the level of need of the folks that are there. They look like a group home. They look just like a group home, but they have more supportive health services. There's 11 sponsored homes. Sponsored homes are, I like to say, like adult foster care. So that could be anything from an individual living downtown Fredericksburg having somebody come and live in their home and being paid for that, for the support that they give them. Or it could be a family of 10 out on a farm. You know, so there's lots of options if you want that supported housing. The biggest issue I see is it's not an institution, or it's not a public service where they're always going to be there. So that family, something could happen within that family, and then the individual with disabilities may lose their placement because the placement's not available anymore, and they'd have to find something else. But it really is a good community model. And then there's the assisted living facility is supported, but not as much as a nursing home. I forgot about that one. And supervised apartments, that's a really, really good model where people live independently but have support on site. So I was just talking to the lady from Virginia Housing earlier today, and she mentioned how wonderful, I don't know if do you want to talk about that? There's a program up in Northern Virginia, but it's starting to be replicated across the state, where there's a housing development that includes some apartments for people with disabilities, and the support's right on site. Because as a parent, it's a little scary to, you know, think your young adult is out, or your older adult is out without support in their home. But if they're in an apartment complex where there's other folks that are getting support, it's much more natural. Plus, they make friends with the other residents. And she mentioned that some of these are being built where it's 55 and older, and so you've got people that aren't working any longer, and so they all want to play bingo at the same time, or they want to, you know, go places and do things and develop relationships. So it's not as isolating as if you're living individually by yourself. So community-based options, a lot of times people live with their family, they never left, but they grew up with a disability, or they come back after injury or illness. I know I spoke to a young man on the phone one day, and he was in his mid-20s and had a spinal cord injury, had an accident, and went back home because by the time he got out of rehab, his apartment was gone. He needed supports that he didn't have available yet. They were just new to disability. And I said, you know what, a lot of times I meet people, young people like yourself, and they go home and moms start doing what moms do, and they get stuck. And he said, that's exactly what's happened to me. You know, I can't do the job that I did before. Nobody's even talked about, well, okay, what else could you do? What are you interested in? What retraining? What education do you need now to get back to work? Oftentimes we see people, and a lot of times it's in the media, in movies and whatever. People don't do active things with disabilities, and that's the furthest thing from the truth. I mean, I know my friend Seth wouldn't mind me telling you, even though he's an amputee, he skis, he goes to the beach and does surfboard, training for other people. He recently broke his hand playing wheelchair basketball because he's not a wheelchair user, and they just sucked him into playing on this team, and he broke his hand. So people with disabilities can either hang out at home doing nothing or get involved in their community, and that's what we try to do, is help them. So another excellent option, there's been a lot of discussion in the city of Fredericksburg recently about auxiliary dwelling units. That can be anything from the garage apartment to building a little house on the property to expanding. I mean, I know a lot of families that have young adults, they want to give them some independence, so they may make an apartment in the basement. They may add or change the garage and make that into a separate dwelling. And in the past, in Fredericksburg, there's lots of them around, people didn't have a full kitchen, and that was the question, right? Mayor Greenlaw is having a full kitchen to have an auxiliary dwelling unit. And so we still can have them, you just can't have a full kitchen. But it gives the individual, whether it's your aging parent that lived 3 states away and is going to come and live with you because the spouse passed away, some independence, but yet close by if they need something. I mean, with all the technology involved or available now, it's a really easy way for people to be cared for, but yet independent. And so for my son, that would be a great option, but he needs assistance with his ADLs. I mean, he doesn't transfer from his wheelchair by himself, so he needs somebody around, but it doesn't mean we have to be in the same room. Home or apartment with paid supports coming throughout the day, not 24-hour care. If you're poor, can have Medicaid, you can have your care in an institution, or you can have it at home. And so lots of people choose an agency, and other people choose consumer-directed. We facilitate a consumer-directed program, so you can hire somebody that you want. Could be a friend, neighbor, a family member. And the last option is the apartment with a non-disabled roommate, and that's what my son has. So he does have financial assistance after he was in his place about 5 years. He got a Section 8. And so his roommate is allowed to live there for free because he's giving him support. He's helping him in bed at night, getting him up in the morning, and then Derek has other paid supports that come in and out throughout the day. I mean, one of the biggest problems we found with the transition from the nursing home is having a place to go that you can afford. And so people that have funds don't have, they have as many issues to try to figure out, but it's easier to figure out if you can pay for it. So if you can pay for the housing, then figuring out how to bring the supports in is something that you can navigate. So I think that finding more affordable, accessible housing and how to do that is really important for communities to do.
So a lot of those same options speak to seniors also. There's the owner-occupied single-family homes that a lot of us have lived in now and continue to live in. You pay off the mortgage, and then that kind of helps you live the rest of your life with options, your options. There's townhouses, there are villas, there are condos. One of the biggest developments that's being built now are the 55 and over communities, the villas, 2, 3, 4 houses together. That's what my parents lived in. It worked very well, 1 story. A lot of those now are 2 stories. As you drive around and see them, they're big, big houses that are being built as 55 and over active community housing. We do change, we get older. Stairs are not people's friends for all of their lives, so that's something that really, really needs to be thought about when people are looking for their next home. There are apartments, both market rate and rental assistance. I know people in the city of Fredericksburg were probably familiar with the Madonna House fire, apartment complex on Cowan Boulevard that caught fire one night. It displaced, I believe it was 170 apartments that we had to find places for people to live. That was in May of last year. I think it was in May of last year. And we just recently had a lady that we helped with rent who she could not go back to the Madonna House. A lot of people said they didn't. It was a long story, but they didn't want to go back to Madonna House. She finally found a new apartment in Spotsylvania County at an older adult community. They're that beautiful ads in the newspaper with people that look like the youngest people here in the room, really, really nice places. They're not built with handicap rails in the bathroom. They're not prepared for people to grow older. You don't stay 55 forever. You don't stay as active as you were at 55 forever. We hope and pray, but we change. You have family homes. As Debbie said, you've got places that you have had in your family for years and years. You can go back and live with your family. And there are those auxiliary dwelling units, which provide an extremely important housing option as far as either having your house where your kids move into a certain house, part of the house, or you move in and your kids move into the larger house to take care of it. That generational wealth continues in that case. There are also institutional housing for seniors. Please, we hear so many times, I will never put my family in a nursing home. Please don't ever put me in a nursing home. Please don't ever say that, because you don't know what the situation is. I see Fredericksburg DSS shaking her head. It's a hard thing to do, but assisted living facilities and nursing homes provide a purpose, a very important purpose. There are some people as they age need more care than others, and that is a wonderful, wonderful option. Assisted living is just that. Somebody needs a little bit of assistance, maybe reminders to take their medications. Maybe they need help showering, bathing. They need help cooking. I'm getting older. I'm starting to not like to cook at all, so we know where that goes. And assisted living must be state licensed. Now, there's also private care homes, which would be houses. And you can take 3 or less people into your home and provide care without licensing that house. When you hit that 4th person, that's when the state's going to come in and license you. They provide an important purpose also, but you need to be careful because of that lack of licensing. When people are taking care of people in mass settings, you really do want somebody to oversee that when somebody's taking care of you when you can't. A nursing home plays an extremely important role for those who cannot care for themselves. typically have medical issues. They are licensed. They are, as an assisted living, they are monitored on a regular basis. There are DSS, APS workers. There's our state ombudsman that go in to make sure that, that people's rights are being met every day. That is their house, their house. They can do what they want in their house, like the three of us and all of you can do in your house. So the issues that we face with people with disabilities and that are 60 and over are, of course, affordability. That's what we're here talking about. Is the house affordable? How can that be met? What is affordable? The big question that we've talked about. Megan had mentioned rents. Our seniors at Healthy Generation, the average income for our seniors is about $1,400 a month. That does not get much of an apartment, if any of an apartment. Physical accessibility. There's very little of the nation's housing stock that even offers the most basic accessibility. I mentioned the apartments for 55 and over that have no railings. They don't have emergency buttons. They aren't even being built with automatic doors at their front entrances. Crazy. Assistance and services, the needs for support for those with disabilities and older adults with activities of daily living and household tasks. The people that can be placed into homes, the services that can be provided either through Medicaid or through your own savings. It's important to be able to live in a facility in which could be your home the way you want to. And it does break down a lot into affordability. What can you afford and how can that keep you home? The assisted living facilities, right now, you can have an auxiliary grant. The problem with an auxiliary grant is, and that is money that helps subsidize somebody in an assisted living, is that the reimbursement rates are so low, assisted livings will not accept those people. There's money that's out there being not used because nobody will take that. You can't, the people's income is just a little too high. And I think, Liz, you can help me, a little too high is about $2,100 or so. Okay, $1,700. So if you have that income, anything over that income, you don't get that assistance. You can't use it. So that's a lot of people who can't afford assisted living, and there's money there. The laws need to change. And it did just recently. It increased a little bit. But all of that money needs to be available to people that are in need. Long-term nursing home care, it can be paid through institutional Medicaid, but it is a costly alternative. I had written down, it's about almost $300 a day in a nursing home. If we were able to provide either our services through the Healthy Generations, maybe just somebody to go in and clean and help in that way, it would be such allow people to stay in their homes at an affordable rate. Affordability, right? We talked about that. I'm not going to go into it, but what we can do is to provide rent controls, subsidize housing availability, house sharing, and homeowner tax relief. The counties and the city do have tax relief for seniors. Those incomes, times are changing, and those of us who have made a little more money than somebody else, we still need that help. The incomes, the cost of living has gone up substantially. Making a house accessible, there are many, many programs out there that can do that. We're talking about ramps, stair lifts, widening doorways, bathroom modifications, a lot of stuff that I just mentioned that are not in the houses and the apartment complexes that are being built. Debbie had mentioned technology, and technology is an incredible thing that can keep people in their homes. It's wonderful, wonderful. They're not being constructed, though, or those new houses are not being constructed as far as handicap accessibility is concerned.
That's true. Okay, fast. Just wanted to raise awareness about some of the programs that are available, and I know there was a whole session that I think talked about this, but Virginia Housing has a program that the Disability Resource Center facilitates, and so we're the community partner for that. And so the first one's Granting Freedom. That's for veterans. They can own or rent their home, and there's no income limit for them. But what there is they have to have disability-related, service-related disability to qualify for that. There's the rental unit accessibility modification. We've facilitated this for years, and so someone who meets 80% of the AMI is available to get modifications done. And that can be a widened doorway or a ramp or a bathroom modification, but of course the landlord has to be agreeable for that to happen. And I don't have a brochure, but the newest program that Virginia Housing is doing that just started in September is for low-income homeowners, and that's a lot of people in the region. So they own their home. They may be living on the $1,600 a month Social Security and doing okay because it's paid off, but then they need to have a ramp put on the house so they can get out. And so this program's going to serve them. So we're really excited about that. Then the other programs around there's some, if they're a Medicaid recipient, there's long-term care, so they meet the level of care for a nursing home. They're going to do home care instead. They have a benefit of $5,000 in environmental modifications per year, and they also have assistive technology, $5,000. And so combined, that can, do a lift system and, widening the doorway to the bathroom. There's lots of nonprofits, a lot. There's a few really great nonprofits. SAWS, they just do ramps. The 516 Project. James, I talked with him today about partnerships that we could do. The Community Development Block Grant, there's churches that do like 1 week things in the summer or we'll do one a month. There's civic organizations that will volunteer. So there's lots of ways to find volunteers to try to get it done. It's just finding the funds for the product. And now, things are so expensive. James and I were talking about the aluminum ramps. We used to always use those, and now they're priced so high that we don't do that anymore. What are we flipping to?
Nothing.
Nothing?
Flipping to
Oh.
wrap up.
Oh, we're wrapping up. Well, the last thing I just really wanted to mention is visitability. The idea that all new building should have 3 components of visitability. 1, zero clearance entrance, so you can get in. Doors wide enough, 32 inches. So again, you can get in, you can get out. And 1 bathroom on the main floor that allows wheelchair access. And then that house, anybody can visit. Lots of people could live there too, but anybody could visit. And that's, I say, so short-sighted that we're not building all new building that way.
We could talk all day. Come on to our offices and talk about some things that are happening out there that need to happen. But remember, housing is a human right, and unfortunately, too many Americans, especially people with disabilities, are not being equally granted the right of affordable and accessible housing they can afford. So again, we appreciate you being here. Don't walk across that street when you hear about somebody talking about seniors and those with a disability, because it's you and I, and we're in this together. So thank you very much.